Good morning, everybody. Doc Dave here again with On Call with Doc Dave. And today we got episode number 25. Quite the milestone for me. And anyway, today's going to be interesting, and it's going to be directed towards my male audience, the older male audience, which is my age range. So this will be exciting and educational. So tune in for all you guys and listen up to what I have to say. So men's health over 50 years of age. Now, before we get into men's health over 50, I want to say one thing about men is that the biggest killer of men under 50 years of age is suicide. So talk to your kids, be on top of what's going on. If they feel depressed, get some help. So getting back to men's health over 50 years of age. First, the biggest issue and the biggest killer is heart disease. 25% of all male deaths over 50 is due to heart disease. And half of these, which is a pretty substantial number, there is no history of any symptoms of heart disease. So at least there's no history. Doesn't necessarily mean it wasn't there. People ignore it, people deny it, and then it's too late. But as a rule, half of the 25% of the men, which is obviously going to be 12.5%, have no symptoms of any heart disease when they pass away. So we'll go over causes and stuff shortly, but basically, in a nutshell, the causes are hypertension, coronary artery disease, elevated cholesterols, smoking, dietary. So that's the things you need to do, and not to mention a sedentary lifestyle. So, number 2, diabetes mellitus. Now, this is adult onset diabetes or type 2 diabetes, or what we call non-insulin dependent diabetes. And this is 10% of all male deaths are due to either diabetes in itself or complications associated with diabetes. And what are these complications? Well, stroke, big time, kidney failure secondary to uncontrolled diabetes, heart disease, which we just mentioned, limb amputations would get infected and get osteomyelitis and cause sepsis, and you can pass away from that. Multiple urinary tract infections, which can cause kidney infections, which we call pyelonephritis, which can cause sepsis as well. And, non-life-threatening disorders, but definitely lifestyle disorders, erectile dysfunction, and urinary incontinence. Third, CVAs, or what the layman would call strokes. It's due to a blockage of the cerebral arteries. There's a couple of 2 or 3 main arteries. I won't go into detail in the anatomy, but blockage. And the culprits for stroke are as follows: hypertension, big time, diabetes mellitus, uncontrolled, obesity, obviously uncontrolled lifestyle, smoking and alcohol, again, uncontrolled lifestyle, and drugs, specifically methamphetamine. Now, and strokes can be very devastating. A few people recover, not very many, and so you're going to have a lifestyle of difficulty speaking, difficulty moving different motor areas of your body, difficulty walking, and even difficulty thinking, remembering, this and that type of thing. So stroke is something you want to try to avoid as much as you can, and those precipitating factors I just mentioned should be controlled. Now, number 4, lung cancer. 50 to 80-year-old men, that's generally when you start to see it, with a smoking history generally over 20 years, although it can come in earlier And it can even come on if you don't smoke. That's the scary part, especially if you're around secondhand smoke. So, asbestosis in the older days, during the war, shipyards in the Navy, homes back in the 50s were built with asbestosis on your ceiling. They looked nice. It was an insulation. They kind of sparkled. Everybody liked it back in the day. Working in asbestosis factories, such as brake factories and this and that type of things, can expose you to asbestosis, which will precipitate mesothelioma. I know we always see that on TV all the time, but mesothelioma is a calcification in the lungs, in the lower lungs that you can see on a chest x-ray, and it's secondary to asbestos exposure or asbestosis. But smoking is obviously the number one cause. Now, number 5, liver disease, secondary to either viral hepatitis, cirrhosis, alcoholic in nature, bile duct disease, cancers in the bile duct that cause obstruction. Again, alcohol and smoking can actually cause liver damage. Certain drugs can cause liver damage as well, so always discuss this with your doctor when you're on medication. He'll need to monitor your liver function test that can easily be monitored by blood tests. Number 7, depression. Now, we talked about men under 50. Number 1 death is suicide. Number 2 is trauma, by the way. But depression in older people is even more prevalent than it is in younger people. And it's more prevalent in when males have it, they have a tendency of ignoring the symptoms and not seeking treatment. Whereas the women generally are aware of the symptoms and will seek treatment. So it's the stubborn male gene that'll get you in trouble there. Now, how do you know you got depression? Well, it's generally symptomatic in nature. You are feeling extremely tired all the time. You have difficulty sleeping or sleeping too much. You become antisocial. You don't want to go out and expose yourself with your friends, your family, social clubs, and feeling of hopelessness. That's a real key symptom of depression. You just feel hopeless. There's no endpoint to this. There's no treatment for this. That's what you're thinking, but there are treatments for this. And the treatments are obviously seeking psychiatric care and being put on appropriate medications. And you can get this through your primary physician will refer you to these types of doctors. Now, the next episode is going to be after depression. We're going to be talking about prostate cancer. Now, this is very common in men, and men generally start with, what we call BPH or benign prostatic hypertrophy, and that's where, you can't form a stream, you have dribbles, you're going 20 times a night. This can lead into prostate cancer, obviously. So you need to have your doctor do your checks on you and your annual physicals. There's a digital check that he can do to check the size and function of the size and formation of the prostate, if there's any lumps or anything asymmetrical. And, what are the symptoms of prostate cancer? Well, I mentioned a few earlier. Difficulty starting a urine stream, weak or small flow during urination, even interrupted. You can start and stop. Urinating often, much more frequently, because you're not forming a complete emptying of your bladder. And, so you have trouble emptying your bladder. That's going to cause often urinations. Pain in the back, pelvis, or hip area, not getting any better. So, hey, this isn't musculoskeletal. This is something else. And last but not least, family history. If your father had it, your brother had it, your grandfather had it, be aware. And like I mentioned earlier, the tests on this are the digital exam and something called the PSA. And that's a blood test they can do. Although it's kind of losing its allure because they've had some troubles with the PSA, the quality control of it, but it's still something to recommend. Now, with that being said, the next big problem in men is COPD, pneumonia, and flu. This will kill a large amount of elderly men, especially if they've had a history of smoking. And you get the emphysema, and you get a lot of secretions. You have an ineffective cough reflex. You can't clear the secretions. You can aspirate them, and then you get pneumonia. So pneumonia is really a almost death sentence if you have COPD and you're, say, over 70 or 80 years of age. So the other problem with your lungs with COPD is you get bronchitis a lot, which are infections in the upper part of your lungs, versus pneumonia, which is an infection in the lower part of your lungs. And you can get congestive heart failure from hypertension and heart failure and the water, quote unquote, water in your lungs. So, the last thing I want to mention, and it's not necessarily a disease, actually it's a natural process, but a lot of men overreact to it, want to get their youth back, is low testosterone. Now, like I said, it's a normal part of aging. Don't fight it. These exogenous medications can cause liver cancer because it's going to stimulate the liver to produce testosterone, which isn't there to produce. So that part of the liver gets overstimulated, and it can develop a cancerous side effect from that. And number 10, the very last one, is accidents, unintentional accidents. Falls at home, number 1, hitting your head injury, subdural, epidural, skull fracture, boom, you're done. The other one are broken hips, which can have a lot of complications just from the hip fracture itself, but a lot of complications from the surgery and the recovery from this. So those are the 10 major disorders that men have after 50 as they progress during the latter parts of their life. Now, how do you take care of yourself? How do you prevent some of these disorders? Things that you could do to eliminate things. Just like if you got an illness, you're going to take a medication. If you get an infection, you take an antibiotic. If you got hypertension, you take antihypertensive. Diabetic, you take diabetic meds, and so on. So how do you take care of your body without having to take, medication for it? Well, number one thing is keep your regular health appointments. See your doctor on a regular basis. Every year, get your annual physical, because things can change quickly. And if you wait 2 or 3 years, you're going to be behind the 8 ball. And they always say if you got a disease, it's best to discover it early. So, and the other reason to see your doctor is for preventive preventive illnesses, such as colonoscopies. It used to be you get one after 60, then after 55. Now it's kind of after 50. And the leading cause of deaths in males under 50, other than the suicide, which we mentioned earlier, is colorectal cancer. So you got to be on the ball with the colonoscopies. It's a bit of a, discomfort to prep for it, and it's not uncomfortable to have it done because you're sedated. You don't even know it's done. You just wake up and you go home. But the prep's a little difficult, but it's worth it in the long run. Now, number 2, eat healthy. No more kids' fast food. We're 60, 70 years old now. You can't be going to McDonald's. They should refuse to give you fast food if you're over 30 years of age. You got to show your ID. Remember how you used to have to show your ID to kind of drink earlier? You get a false ID. Well, now you're going to need a false ID to go to the fast food place. So that's something that you got to know. You got to have healthy foods. You got to get your vegetables. You got to have your fruits. You know, you got to watch what kind of meat you eat. And you know, this will help prevent hypertension because you don't salt your food anymore. It'll help prevent diabetes because you're not eating sugary foods anymore. It'll help prevent a lot of diseases. So diet is very important. Plus, it'll keep your weight down because obesity is a real risk factor for older people as well as medical conditions such as hypertension, diabetes, strokes. They're all related to obesity in one way or another. So, move more, sit less. Take walks. You don't have to run, you don't have to jog, you don't have to hike. Go out for a 1 to 2 mile walk a day. Get a dog. It's great. The dogs will keep you walking. The dogs are good companions. It keeps your feeling of depression minimized. And, you know, so get your exercise. Maybe go to the gym, do some light workouts, do some stretches, do some balance maneuvers so that you don't have these accidental falls and hitting your head and breaking your hip. Number 5, decrease alcohol usage. You don't have to necessarily stop it. You just got to maintain it a little bit. You know, they say in a male over 50 or 60, you should not have more than 7 to 10 drinks a week. Now, I know that sounds a lot. I mean, but it's basically 1 drink a day. Have a glass of wine, have a beer, have 1 scotch. That's it. You can't be having 3 or 4. Can't be drinking a bottle of wine like you did in your 30s. And number 6, and maybe the most important, stop smoking if I haven't already convinced you to do that. COPD, emphysema, pneumonias, coronary artery disease, strokes. Nobody smokes anymore. Nobody should smoke anymore. I mean, come on, we've known this for 70 years now that smoking's bad for you, but people continue to do it. So you got to kick the habit, as they say. So final thoughts on men's health over 50. Number 1, adjust your lifestyle as you age. Don't try to fight it. And by adjusting your lifestyle, I mean dietary, we've already gone over that. Exercise, we've already gone over that. Social activities, we've gone over that. You know, spend time with your kids and grandkids. Join a club, whatever you want to do. That'll help prevent any depression onsets. Now, avoid bad habits, alcohol, smoking, and drugs. Common sense. Number 6, get regular sleep. 7 to 9 hours a night is thought to be appropriate. You don't want to be sleeping 10. You don't want to be sleeping 4. Number 7, stimulate your brain. Read. Get a book. You don't have to read a book a day. Read a book a month. Read a book every 2 months. Keep your brain active as well as your body. Number 8, avoid over-sunning. Now, you can go to, you retire, you're 65, you want to travel, you go to the south of France, you go to Italy, you go to countries with nice weather, Cabo. You can't be not out in the sun. Just, use sunblock, monitor your sun usage. Don't be getting sunburns anymore. We're not 6 years old anymore. And, watch the melanoma onset. Get checked, dermatologist periodically. Number 9. And number 10, I'm going to put this in 2 categories. Have a harmonious marriage. That'll keep your stress down. It'll keep your thoughts happy. You got a companion, you got a dog. I got a wife, I got a dog. I'm perfectly positioned. I got kids, I got grandkids, and I'm retired. So I'm doing this lecture for myself. I'm the perfect person to follow these directions. So there you go. Men's health, important stuff. Pass this along to your father, your grandfather, your friends, your male friends, if you're in your 50s, 60s, 70s, 80s. It's really good stuff in here, very educational, a little entertaining, and that's what I like to do. I like to be educational, I like to stimulate your thoughts as you listen to this, and I like to be entertaining. So if you like this, then you like me. And if you like me, hit the like button. hit the subscribe button. Doesn't cost you anything. Makes me feel good. It keeps me from getting depressed. And remember, again, I'm your friend, not your doctor. So all of these things I've talked about, you got to communicate well with your doctor about. And I'll be back soon again for another interesting episode. And thank you for your time.